Meow, Huples cat and Biscuit and Wolfie. So I've been hammering home the whole point about human-caused climate change the last couple of weeks because I think it's really important whether you believe the science or you disbelieve the science, and honestly if you don't believe in it, you're disbelieving real science. It's actually somewhat trivial and irrelevant. The important goal is of course to prepare for severe and unexpected climatic changes. But we are currently experiencing a global SHTF in the form of a mild pandemic called COVID-19 disease. And I want to go back to that for a week or so because there's a lot of misinformation out there and there's a lot of untruth out there, and the bottom line is that nothing really has changed. What I've been saying in my last update, because I don't do daily updates every time a piece of research is published, is that distance, mask, wash your hands, limit contacts, try not to go out too much, be very cautious. Specifically, if your area doesn't have rising cases. It will have rising cases because of Delta and Lambda variants at some point. But enough of that from me. What does Jennifer Aniston have to say about this?
The actress said she's ended a few relationships in the past year over anti-vaccine stances and opinions. Aniston noted that they were among that, quote, large group of people who are anti-vaxxers or just don't listen to the facts. And while Aniston says people are entitled to their own opinion, the actress noted she feels there should be a moral and professional obligation attached. It's a real shame. I've just lost a few people in my weekly routine who have refused or did not disclose whether or not they had been vaccinated, and it was unfortunate. She added, I feel it's your moral and professional obligation to inform, since we're not all potted up and being tested every single day. It's tricky because everyone is entitled to their own opinion, but a lot of opinions don't feel based in anything except fear or propaganda.
What she's doing here, she's actually representing the majority view. Whether you agree with that or not, it's actually true. The majority of people feel that COVID-19 is true. The majority of people feel that it's serious enough to warrant extreme social changes on a temporary basis to deal with it. And that those that do not believe that agenda are actually deluded at best, and at worst, their denial is dangerous. I happen to agree with her. My first advice to you is to cut out of your life from close contact all people who are unvaccinated and choose to be. There's a tiny number of people who can't be vaccinated. The vast majority of people are choosing, based on very false information, to not be vaccinated. They pose a risk to you whether you are vaccinated and masked or not. It's just not sensible to hang out with people who are dangerous to you. And to go further than that, there's a lot of people out there who are lying about things, who lie about their risks, who lie about their contacts, who lie about their vaccination status. These people are lying in a pandemic. They're really not the type of people you want to associate with.
Now to a live look from Moody Gardens, where COVID has just shut down the water park. Our Melissa Correa confirms 6 employees who work at the Palm Beach attraction tested positive for the virus.
She joins us live now. And Melissa, how long will the outdoor attraction be closed?
Hey there, Reka. Today and at least tomorrow, 600 people work at Moody Gardens. Currently, 10 of them have tested positive for COVID, and 6 of those folks work at the Palm Beach area. Take a look. Moody Gardens sent us some video showing us what the outdoor water park area looks like. Staff are required to wear a mask even while working outside. The only exception are lifeguards who sit at a post. Moody Gardens requires that staff who come in contact with positive cases stay home for 5 days. That's why there's just not enough people to work Palm Beach today and tomorrow.
So as the global fourth wave rolls up, we should expect shortages, closures and general inconvenience. I haven't covered it, but there's a whole bunch of articles and videos online about the poor English people who are on holiday in Mexico to arrive there to find out they have to pay thousands of pounds when they get back to be quarantined. They weren't aware of that when they went on vacation to Mexico. Again, do not go on vacation out of province, out of state, out of county. Don't vacation in your own country during a pandemic where cases and infections are rising. It makes no sense. Think local, have a staycation, but do not go on holiday. It's a really bad idea.
This has been a summer of vacation time for everyone. So we do know that cases are on the rise throughout the country, though. So we all have to remember to be more diligent and take all the steps that we need to take.
So this is my second piece of advice. Take precautions before the local surge happens. I'm in Toronto. We have very low cases. This is exactly the time that you should be really locking down, wearing masks, distancing, washing hands, and monitoring your health. You've got to be very, very careful when there's very few cases locally until we know this has gone away. It has not gone away. It is surging globally, and it will surge in Toronto at some point. And I can tell you, as a freshly almost retired nurse in Toronto, our hospitals are completely and absolutely unprepared to deal with a significant fourth wave. It's going to be terrible, and it's going to happen. And that's the sad thing here. We know this is going to happen. And everybody's sitting around going, oh, look at Florida, we're not that bad. You've got to really think it for yourself. You've got to be cautious about believing politicians and health authorities. They have a two-pronged job. They're to mitigate the effects of it and also to get it finished as quickly as possible. But they've also got economic concerns, which are vital. But you as a person, you need to look at the data, and your own choice should be based on the precautionary principle, not on fake hope COVID's unreal.
It's going to take her to the Olympics.
Used to running great distances, marathoner Dana Pedereski spent the last week pacing a hotel room after someone on her flight to Tokyo tested positive for COVID. She's been cleared just days before her race this weekend.
I still feel like I don't really get much of an Olympic experience, but the race could certainly change that. I hope it does.
The unexpected quarantine threw a wrench into her pre-race regimen. Friends and family have helped pull her back into the zone.
I know no matter what, they're going to be so happy.
But COVID has shut other athletes out entirely. Yesterday, 5 of the 12-member Greek artistic swim team tested positive. They've all been moved out of the Olympic Village, their dreams dashed by the virus.
They are also no longer eligible to participate in the team event. We wish them a speedy recovery.
And today, it wasn't an athlete, but COVID, which set a new record in Tokyo. 4,166 new cases. From beneath multiple masks, this Tokyo woman says she's very worried and tries not to go out as much as possible.
Now, if you ask me, going ahead with the Olympics was completely stupid, completely inane, totally wrong, at best tone deaf, at worst a dreadful, dreadful insult to people who are struggling in Japan specifically and elsewhere from a pandemic. There was no need for it. I have been a national class athlete in my life, and I'm telling you right now, I would not have gone to Tokyo to take part in the Olympics during a pandemic. It's just wrong, and it's always been wrong. And yeah, they may miss their chance of getting a medal. That's nothing compared to what's going on in Japan with their rising cases.
So great are the demands now on hospitals. People with milder symptoms being asked to stay home and not seek care. Please understand, says Japan's health minister, this is to ensure we have enough beds.
Now, a lot of people talk about rising cases, and rising cases is significant only if it results in rising hospitalizations and rising deaths. If there is not deaths and there is not hospitalizations that are significant, I don't really care about catching COVID or the number of cases. But the truth is that currently, rising cases will mean rising hospitalizations and will mean rising deaths. That is why a large number of liars, misinformed people are online right now, today, telling you clearly that there's very few hospitalizations, there's almost no deaths compared to the deaths from the vaccination. All of these things are easily debunked on a personal level, and I suggest you debunk them if you even think they have marginal reality. What they're trying to do is create their own false sense of a world and impose it on the actual reality because they can't cope with the fact that we have a pandemic. They're not able to cope with it. It's just beyond them.
Rising COVID cases now putting both host country and visiting athletes under increasing pressure to perform under extraordinary circumstances.
All I can do is give my best on race day, regardless of the tribulations that have occurred the last couple of weeks.
And on Saturday, she'll do just that.
Yeah, unfortunately, hospitalizations are going through the roof in Japan. We look at it daily, blah, 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 and they've seen a little bit of a reduction in deaths. Cause for celebration. No, it isn't. Deaths tend to lag between 2 to 4 weeks behind hospitalizations, so they've got the deaths baked in from the hospitalizations and the rising cases. That's the unfortunate thing. Protect you and your family. before cases rise, definitively, if you can. If you can't, definitely start taking strong precautions as hospitalizations rise. I'm not watching any of the Olympics this year. I'm not clicking on any news report at all on the Olympics, other than the ones that are talking about the effects of the Olympics on people in Japan, because I think it's really bad taste. I think it's really bad. I think it's like going on a beach holiday to Mexico. Do you not have any empathy? Do you not care what's going on and has been going on in Mexico because of the pandemic? You feel that you should fly to Cancun and have a holiday. Well, you can justify that whichever you like, but frankly, it's really bad taste and it says a lot about your moral character. But even worse, you're actually putting yourself at an enormous risk of actually catching the local variants of COVID, some of which have not yet been identified, but will be. So that's my other piece of advice. Do not go on holiday. Do not go on vacation. Do not travel out of province or out of state for holidays. If you absolutely have to travel, lock yourself down as tight as you can during the travel, while you arrive and when you come back. We can sacrifice a couple of years to avoid dying. I can anyway. It's sad for the old people. It doesn't mean life stops. Like yesterday, for the first time in 2 years, Kitty and her sister actually got together with her parents and went out to their favourite restaurant pre-pandemic to actually celebrate John's 88th birthday. And doesn't he look good for 88?
Start again. A lot of our waitress at our table, and she's a lot of fun. So in the process of our talking, I don't know how it came around, but we said, how old do you think we are? And she says, I don't know, 60? So I said, well, I'm 87, going on 88, and my wife is 85, and she went.
And he's a great guy, and I'm really glad we went. We took our own hand lotion, we wore masks, we were very cautious. As you can see, or maybe not see, the separation between the tables is large. The waitstaff are wearing very good masks.
Look like tourists.
Well, cheers.
Oh, right.
Happy birthday.
Thank you, sir. Appreciate it. Here. For y'all. Oh, I think it's a wonderful idea.
All the time. They're not wearing them like this. They're wearing them like this. And they're keeping distance. And even going to the washroom, which I didn't video, was a bit of a hike. Because they didn't want you just strolling past other diners to go to the washroom. But again, if you're using washrooms, wear an N95 in that washroom and be very, very cautious of washing your hands. It is an enclosed box. I know some people are going to say the Olympics are important, and you know, even though it's a professional thing for most people who take part in it and it's about money and advertising, it is actually really important that the Olympic spirit is not ignored. And I think the Olympic spirit in no way said, let's go and get gold medals for our respective countries to promote nationalism, whilst over 100,000 children in Mexico are now orphaned. I don't know why you think that's good. I don't.
6 months ago, during Mexico's second wave of COVID-19, Alma Aviles lost her partner Jose to the virus. He also left behind 4 young children, turning a happy domestic life into a daily struggle for survival for his widow.
It has changed everything. He was the main breadwinner, and I can't work because my older kids have mental disabilities, and I can't leave them in charge. And emotionally, it has been very difficult. We're all in family therapy.
Alma now relies on state child support payments, less than $60 a month in total, to support her young family. And these kids are far from the only ones struggling with such deep loss. The COVID-19 pandemic has impacted families in Mexico perhaps more than any other country in the world. A recent report by The Lancet found that more than 130,000 children have lost at least one parent to the virus, more than any other nation studied. And with government programs for vulnerable minors already strained by funding cuts, advocates here worry that children will pay the price in the long term.
So this is my other piece of free advice for you. What are your plans for your children and your pets to be looked after if you get hospitalised and are sick for a long period of time? Or even worse, if you're hospitalised or not hospitalised and you die. It's always a fact that people die. Mortality remains 100%. What COVID's done, it's dropped life expectancy across the planet and it's killed people multiple years before they were expected to. So we protected our old people and we vaccinated them and we've looked after them in nursing homes and they're being very careful because they've seen peer group die. So that's great. However, what's happening is the average age of hospitalization has dropped in parts of the world and parts of the United States, and it's dropped to the average age in the country. Now, it doesn't take a mathematician to point out to you that means that a lot of people, half the people who are dying, are beneath the average age of 50. Of course, one of my rules is when I make a rule at the beginning of the video, I break it in the video. So this is some very recent research, and I'm not going to bore you with it, but basically it's from Israel. It has high vaccination rates, and they did retrospective studies on vaccinated healthcare workers to see what happens if you're vaccinated and you're still exposed to COVID-19 in your workplace. Really good way of seeing if the vaccinations work. Well, what did they find? They found that breakthrough infections are very low. Very, very low. What they found was for the majority of people, they were either asymptomatic or didn't really notice it. They found that some of the vaccinated would have strong viral exposure. They'd actually be able to produce a lot of the virus without having any symptoms. That's a key thing. This is why masking is being required in the vaccinated group. One of the interesting things they haven't focused on, because this is a pro-vaccination research and it's been promoted that way, is that 19% of those vaccinated people have signs and symptoms of illness more than 6 weeks after being diagnosed. This isn't really long COVID. It is long COVID for some of them, and most of the symptoms aren't really that significant, but they're significant enough to be noticed and affect lifestyle and quality of life more than 6 weeks after exposure to the virus. Again, this is why, even if we're vaccinated, don't get sloppy around strangers, don't get sloppy around infected people. You can still catch COVID because it's a vaccine, it isn't a cure, and you can in fact get quite sick for months later. The chances of dying, the chances of being hospitalized are very, 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 very small compared to not being vaccinated. Hence, not being vaccinated in August of 2021 is an idiotic idea and absolutely isn't backed up by hospitalizations, cases, deaths, and age group affected, and health of the people affected.
Fully vaccinated people do have the potential to be able to transmit COVID-19 to others. This appears to be reduced with vaccination, but it's not reduced enough to allow for unmasking in all situations. Because of this potential, that's why people in areas of high transmission are still asked to mask. This is also why people who are in areas where there are especially vulnerable patients, or people like in hospital settings where we take care of patients who may have weaker immune systems, are still recommended to wear masks to protect those who are at the highest risk of transmission, even from vaccinated people. We know that some people who are vaccinated do have the ability to have high levels of virus in their nose and in their throat, even if they don't have symptoms. This isn't a surprise. Many different types of vaccines prevent illness, but don't necessarily prevent you from being able to transmit that illness to others. What I say to people who are concerned that they can still get infected by the Delta variant, even though they're vaccinated, is your illness, if you do get infected, is going to be far, far less severe than if you don't get vaccinated. Most people who get the vaccine aren't going to get infected. Of those who do get infected, it takes what can be a deadly illness down to something you may not even aware of, or even a bad cold at the worst. Unless you have some of these immune compromising conditions where the vaccine doesn't really take and you're in one of those vulnerable groups, your risk of having a severe infection that lands you in the hospital or puts you in mortal danger is far, far lower when you get vaccinated. Widespread vaccination is still our road back to normal.
So I think to some degree you shouldn't listen to me or this video. I really don't think you should listen to Praxis Prepper. Sorry Praxis, I couldn't help that, but really you need to get vaccinated and stop pretending you don't need to. You need to be vaccinated. You are clearly posing a risk to your children and yourself. And I'm sorry about the fact you feel you're isolated and you're safe. We can all break a leg, we can all get appendicitis, we can all have to go to hospital. I don't think non-vaccinated status is smart. I know you've gone into depth with your reasons, I don't buy them. It sounds like an excuse. To me, you don't want to give up control of your health and your body to a vaccine. And it's a philosophical point of view that isn't backed up by reality.
If enough people are vaccinated, we will reduce transmission of the virus. We know that even though it's not perfect at reducing transmission, it drastically reduces it. It reduces your risk of being hospitalized or having severe illness even more. And if enough people are vaccinated, the risk of things like having overwhelmed hospitals or large numbers of very sick individuals goes down, and we can start to get back to normal.
Simply put, the precautionary principle we should always be doing. You take precautions from getting infected from a disease, using whatever you can to avoid getting that disease, because you don't want to catch the disease. You don't assume you won't catch it, like Praxis is. He's assuming he won't catch it. You don't assume that you will not be very ill from it, like he is, because I'm younger and I'm fit. You actually look at the data and you think, yeah, there's a significant risk here, enough of a risk that I actually could get sick enough to really, really be bothered by this, or even worse, I could die from it. It's unlikely at my age group and fitness level, but the reality is, from the data across the planet, it's not just one government churning this out, is that you're at risk, serious risk, not trivial risk. And the risk from the vaccinations is minor, very, very minor compared to the risk from the disease. It's pretty straightforward. The facts are there. A lot of people are actually lying about the facts and are pretending otherwise and are saying things like, why be vaccinated if people have breakthrough? It shows the vaccines don't work. No, it doesn't. It really doesn't. And it's easily disproven. So this is my other message. Until worldwide infection rates are dropping like stones, keep masking, keep distancing, keep washing your hands, keep being careful around people, keep being very cautious with symptoms, monitor yourself frequently for O2 sats and other things, and make sure that you take advantage of actual medical care from people like the people that work at the Mayo Clinic, not from people online who are pushing rubbish like dewormers at you. It doesn't work. They've done clinical trials. It doesn't work. They're even doing more clinical trials because there's so much rubbish being put out there. The effort looking for cure from a cheap pill because government and big pharma are evil actually has got nothing to do with the disease. It's got a lot to do with paranoia and psychosis. We know that hospitalizations lag rising cases. We know that deaths lag hospitalizations. This is well known. I don't think anybody's actually disputing that. At least I hope not, because if they are really flat earthing this whole thing. So this is not good news. Hospitalizations are crushingly rising in all of the areas with large infections in the community. All of them across the planet. And I will get into some specific areas of the states and other places in a following video. But this is not the time to be taking the vaccine. This is not the time to be washing your hands and wearing a mask now. It needs to be done before the community has the infection in it for you to catch. But whenever you can get it done, it's better than not doing it. Now specifically the stay at home, be treated at home, they actually don't have a choice with that, and we do that in Toronto. And what we have in Toronto is the COVID program. We've had that running for a year, where you actually use FaceTime on a regular basis to meet with a doctor and or a nurse if you're at home with positive COVID, so you can be monitored by a healthcare professional to see what's going on and whether you should actually be told to go to the emergency department or an ambulance should be called for you. And this is really important. One of the things we have seen, and it's a really shocking thing when you see it, is you'll take somebody like me, a bit fat, you know, in the 50s, on nasal prongs, talking fine, saying, you know, I don't feel great, but I'm not bad, whatever. Within 20 minutes, they're dead. I know. It's a startlingly fast disease process for a minority of the people that have it. Most people crash slowly, and we have a few hours to deal with them. There are people literally who go from walking to the washroom to dead in 10 minutes. So that's why you will hear of people being found dead at home. Now again, on the vaccination nonsense business, people are trying to claim that the vaccines are doing that. There's lots of people dying all across the planet because of vaccinations. I can assure you that that's not true. Anybody with any sort of major side effect from a vaccine or a death from a vaccine, it's being blasted all over the news. Open your eyes, look for it, Google it. You'll see it all over YouTube. They're not being hidden. What's being hidden is the fact that vaccinations work. That's being hidden because a large number of people fundamentally disagree with vaccinations. A large number of those people are rich and are Christian. And why they think that that's an okay thing to get them into heaven, to deny an effective healthcare treatment that prevents hospitalization and death to people, is utterly beyond me. Well, I hope you didn't enjoy this video, because I didn't enjoy making it, because frankly, I'm getting up to here with this. Like, I am sick to death of this. Get vaccinated and shut up about the nonsense you're screaming about New World Order and nanoparticles and I want to make sure it's completely safe before I put it in my body. Like, get real. You guys are eating meat that's processed. You're eating hormones. You're eating bad things all the time. You're smoking. You're taking cannabis. You're drinking alcohol. You're using wood paint and thinners. Like, life is risk. Mortality is 100%. I get it. We can't stay shut down forever. No, but we're going to have to if you lot don't get vaccinated. So you know what? Get vaccinated. Think not of yourself. Think of your community. Look at the risks and get vaccinated. Unless you have a specific healthcare issues, that means vaccination is very dangerous for you, and there's almost nobody in that category, get vaccinated. Talk to a doctor who's not insane, some of them are, and get vaccinated. If you like this video, please feel free to give me a subscription and or a thumbs up and or a thumbs down. I think it's really important, if you don't like this video and you disagree fundamentally with it, that you actually subscribe to me, because you need to get input into your brain from people who are on the other side of equations or have a different perspective. I think it's really, really important. Either way, thank you for watching this video if you watched it all the way through. I do appreciate it. And for me, and Wolfie, and Biscuit, have a great day. Try not to worry too much about this. Thankfully, at the moment, COVID-19 is a pretty minor disease. Don't get caught up in, is it human made? Is Fauci behind it? Was Donald Trump deliberately infected? All of those nonsense things you're hearing out there, like, just dismiss them. Where there's a vacuum, people panic. People throw information into it. We don't know if COVID-19 is going to just fade away, like SARS did. We don't know if it's just going to be minor outbreaks like MERS. We don't know. And we could see it get worse in terms of infectivity, which we're seeing, but also in terms of death percentage, which would be a real calamity. And at that point, trying to get a vaccine, good luck to you. Because the only thing that actually reduces your chance of death and hospitalization is vaccination. Distancing, masking, gloves, sterilizing your Amazon parcels help reduce the chance of you catching it, but the only thing that actually stops you from dying or getting very ill if you catch it is being vaccinated. Yes, if you're in the ICU, there are a few medications we can use. Yes, big pharma's are actually coming out with some tablet form medications that might reduce death and hospitalization if you've already got COVID. Get vaccinated. Stop messing around. Stop making excuses. Give up control of your arm twice or once to be vaccinated against a significant global pandemic. This is an SHTF. Get protect it as far as you can. Use the precautionary principle. And vaccine rejection is the same as hesitancy right now. It's the same thing. People get really sick of it. Anyway, doodles. This has been a video from a sleepy terrier, from his little sleeping cat friend, Biscuit. Bye.